gap present in between the front teeth. It can be a single gap which will be present between the two central incisors or the central upper teeth, what we call it, and it is also called as diastema in dental terms. Or it can also be a generalized gapping between each and every tooth. So how can this be corrected? First thing we should take into consideration is to check what is the main cause of this gap formation. One, is it due to the bone quality, or is it due to any trauma, or because of any pathological intervention because of the tissues which is abnormally grown. So when it comes to the abnormal tissue growth or any tissue involvement, the first thing that comes into consideration when we're talking about the gap in between the front teeth, especially the upper front teeth, is the frenum. Frenum is a small muscle which is present in just below the upper lip and in between the teeth. This can always cause a problem if it is more prominent and if it is growing in between the upper two front teeth. This causes forces to be exerted, which always keeps the two teeth separated, and it always goes into gap formation process. How do we avoid this? One, we can do the gap formation avoidance first by treating the cause, that is by treating the muscle itself. How exactly is it done? The frenectomy procedure is done to relieve that muscle from causing the gap between the front two teeth. So how exactly is it done? This can be done surgically by cutting the muscle in a surgical way, or it can also be done using laser. What is the advantage of laser frenectomy is that it will cause minimal trauma to the tissues and it causes minimal bleeding and hence enhances the healing period. So this will be a better option as compared to a surgical frenectomy. Whereas when it comes to generalized gapping, we can have two methods of reducing those gaps. One, by physical movement of the teeth by using the orthodontic braces. The braces can be in the conventional metal or the ceramic braces, or also we can take help of the Invisalign, which is the latest or the most advanced technique that we have, which is the invisible aligners, what we call it. Thirdly, if the teeth are narrow and the gaps are persistent, then we can take into consideration of building those teeth with composite restorations, or we can also take help of veneers to cover those gaps and give a aesthetic smile. If the existing teeth are already broad and the gaps are still existing, then the better option would be orthodontic correction, because there is no point in widening the already existing wider teeth, which will look unpleasant.